Hi, this is your Houston chiropractor, Dr. Gregory Johnson. And today I'm going to be showing you how we treat myofascial pain syndrome, which a lot of people get diagnosed these days as having fibromyalgia. Fibromyalgia is an increase in trigger points all over the body. Trigger points is a buildup of metabolic waste products just from normal cellular metabolism that gets in the paraspinal muscles, the traps, levator scapula, rhomboids, all the way down. You can have them all the way in the pelvis, in the ankles, in the feet, everywhere. But today we're going to be focusing mostly on the cervicothoracic area. So she has a cervicothoracic myofascitis. Now the very first thing you do is you identify these trigger points. And she got a lot of sore ones in there. And you can see how she has a little bit too much curve. And you notice how I have her head forward because I want to open her joints up. So first thing that we're going to do is we're going to start putting pressure directly into these trigger points. And I'm going to be doing it with my elbow. And you want to have the patient just breathe in and out because they're going to be some real sore spots. And you can actually feel these trigger points. And you want to put enough pressure on them to where you actually feel them melting under your elbow or your thumb, whatever you're using. Now right now I am on her left trapezius and levator scapula muscle. And those are real sore, aren't they? Mm-hmm. Very. Mm-hmm. Now, a lot of patients who have had old accidents, whiplash injuries, football injuries. You had football injuries, didn't you, Faye? Yes. Yeah. Cheerleading. Yeah, cheerleading. There you go. Now, see, there's another big one right there. So you can identify all these areas of trigger points, and you want to get right in those knots. See, there's a big one. That's a trigger point. And you want to put a deep, steady pressure in there. What this does is these tight fibers like this, they'll loosen up and it'll allow oxygen and nutrition into the muscle fibers. And then it also allows the blood to carry out the metabolic waste products just from normal cellular metabolism. Now I use a couple of tools, specialized tools, to get rid of these. We want to break them up. It's kind of like a human meat tenderizer. It's called the Terminator. It's a modified jigsaw that we had retooled. And you can see that it gets real deep. We're going to run that on her paraspinal muscles. Breaking up all of these really tight nodules. And you can even see when I get on top of them how the muscles react. I'm going to let her head down a little bit more. Notice we're doing the paraspinal muscles bilaterally. And we're going the entire length of the trapezius muscle. Now patients can't handle a whole lot of that because the trapezius muscle goes from the skull to the shoulder all the way down into the lower thoracic spine. And the same thing over here, so it forms kind of a triangle. So this entire area is involved. But then, after we're done with that, we want to come in here and make some nice, easy spinal manipulations. And have the patient just breathe normally as we're doing this. And we're going to adjust her upper thoracics here. Because if you don't have the spine lined up, then we're going to have serious problems getting rid of these trigger points. Now she's got a really bad trigger point in this left trapezius one. You feel that right there, Faye? So again, what we do is we put very deep, deep pressure in there, and you'll actually feel them melting under your fingers. Now you can see just from putting her head down in this position, we get a much better angle. Now breathe. I gotta have the patients always breathing because these knots are super, super sore. And then you actually feel ribs out of place in this mid-thoracic and upper thoracic spine when you're doing that too. Yeah. This is one of those things that hurts so good. Right, Faye? I always tell them they'll feel better when it quits hurting. There we go. Excellent. Very good. Now, we have just done a therapeutic activity on her known as myofascial release. That is going to help calm these muscles down and get rid of the metabolic waste products from normal cellular metabolism. You always want to have the patient drink a lot of water after this because we're expelling toxins out into the system. So, if you have myofasciitis, trigger points, or have been diagnosed with fibromyalgia, this is the kind of treatment that you want. It's very effective. This is your Houston chiropractor, Dr. Gregory Johnson. We'll see you next time.